All right, this is where we left off. So I want to teach these two erectile bodies. If you look at the pictures, the picture on the left is where we left off. That's the UG diaphragm. And the picture on the right with the penis, it shows you how the penis is basically attached to the pelvis and it's on the UG diaphragm. And the corpus spongiosum, I guess I have to point to it here. It's this structure that's being shown dissected. So appreciate this is a dissection all the way down to the erectile bodies. Remove skin and connective tissue. And I've done this dissection, and it's very difficult to separate the erectile bodies. I needed a scalpel. But when you do separate them, the corpus spongiosum proximally forms the bulb of the penis. Forms the bulb of the penis. Also forms glans penis. Distally, so you are expected to know that. The bulb and the glans is corpus spongiosum. So that's the bulb, that's the glans. Bulb, glans. It's all well, I guess I should say, I mentioned this last time, the erectile bodies are highly vascularized smooth muscle. And I teach you these because the erectile bodies become erect during erection. All right, now you could have figured that out on your own, right? They're called the erectile bodies. And also, corpse, what's a corpse? A body. So that's kind of term there. And so this tissue, it's like a sponge. It'll just soak up the blood if you vasodilate the arteries. I mentioned that before. Erection is a vasodilation event. I'm just showing you the parts here. So know that the corpus spongiosum is this whole thing. When I point to here, glans, I point to here, it's the bulb. Now the other thing is, inside of there is the urethra. On this picture here, that's the hole for the urethra. The urethra basically is contained within corpus spongiosum. And in fact, that part of the urethra is called the spongy urethra because it's contained within the corpus spongiosum. The other erectile body is Corpus Cavernosa. It's they're paired. They're usually described as paired dorsal bodies. They're also erectile tissue, and I'm going to write this. When you get to the root, they diverge to form crus of penis. Crus means legs. And this is the part that's attached to the ischio, it's attached to the pubic bones. Right here, and then right there. So up here, they're paired, but it looks like they're attached. And this is the ventral aspect of the penis. So these are paired and they're dorsal. They're on top. Okay. And also, we should note that the corpus spongiosum, during an erection, it fills with blood, but it remains soft. It's the corpus cavernosum, they actually become hard during the erection. Let's see. Oh, and also note the muscles that cover the erectile bodies at the root. The other thing that's, let me advance the slide. This shows plugged in. Oh, it's not plugged in. This shows what's called the body and the root of the penis. Well, basically the body is the part that you can see. You can't see the root of the penis. It's the part that's attached to the pelvis. So I'll just write that. Penis, you can see the external genitalia, but the root of penis you can't see. Attached to pelvis. Okay, that's what the figure is showing you with the root and the body labels. And also the root, the erectile bodies are covered with muscle. They're wrapped with muscle. That's what the figure shows you. So I'll name the muscles as Echiocavernosus and the bulbal spongiosus. The crusts are covered with Echiocavernosus. Echiocavernosus. So when I say muscle, that's a muscle. And then the bulb of the penis, that's covered with the bulbal spongiosus, which I had mentioned before. So this covers the bulbous spongiosus, covers the bulb. That makes sense. The name of the muscle, it covers the bulb of the penis, and that erectile body is the corpus spongiosum. Okay? I think I misspelled this. Echiocavernosus. Sorry. Cavernosus. Well, anyways, let me point it out on the figure. On the slide here, this is kind of like a pluralized form of the word. I'm just going to stick with singular. Echiocavernosus is right there. It's covering the crust. So on this side, they dissected it away. And on here, they just kind of like cover it on one side and not the other. So you can kind of see that it covers it. At the root, but not the shaft, okay? And also, if you look at this picture here, if you cut the penis and get a cross-sectional view, you get this picture and this picture. So what I expect students to notice is, can you see those muscles here? Echiocavernosus, bulbal spongiosus. The answer is, what do you think? Yes or no? Can you see this muscle and this muscle here? The answer is no, because what I just get through saying, they're at the root, not the body. Okay. Here you can see them wrapping around, okay? I mean, so if I said identify, and you said corpus cavernosum, I'd mark it wrong. What am I going for? and go over the muscle, because you can see it there. What if I put on the blue stuff? The blue stuff, that's the erectile tissue. So I would put Corpus Cavernosa. Remember how I said they're paired? So how many is paired? 2. 1, 2. This thing, blue tissue, Corpus Cavernosa. Well, what if I point to this stuff around the blue tissue? Bulbospongiosis. But what if I point to the hole in the center? What did I say that it contains? The urethra thing, the spongy urethra. So you're expected to know all that. Now, there's a little hole there and there. Those are probably the arteries. So this kind of makes sense. All right, so you dilate that artery, the blood comes in, it fills this tissue, it becomes erect. So the function of these muscles, I mean, look where they are. They're at the root of the penis. So they'll help maintain erection. When they contract, they'll kind of squeeze. And what happens is they'll just kind of squeeze at the root. They'll help to keep blood in the body of the penis. The other thing you should notice, okay, once again, see if you're awake this morning. Body or root, this sectional view. Body, because you can't see those muscles wrapping it, and you can't see the pelvis. They call this the monkey face. Okay. Well, anyways, paired dorsal bodies, corpus cavernosum. You have a singular forming the ventral aspect of the penis, corpus spongiosum with spongy urethra. Now these vessels here, you don't have to identify them, but you should understand that when these become engorged with blood, you collapse the veins. Now veins drain the blood away. So when you collapse them, you help keep blood in the penis during an erection. So I put the monkey face illustration next to the histology slide. This is from our collection, and I rotated it in a way so it matches. Okay? So you'll be expected to identify the paired dorsal bodies. Boom, boom, corpus cavernosum. You have a singular corpus spongiosum with the urethra, and the epithelium is shown there. I kind of zoomed in a little bit. So basically this tissue here is what erectile body tissue looks like. It's that highly vascularized smooth muscle, erectile tissue. Now this is the epithelium that lines the urethra. The urethra is basically a lumen. It's a hole. So this is the lumen, and it's lined with an epithelium, and it's a transitional epithelial tissue. So I'm going to clear the board here. So I wrote it in red, I'm erasing it now, but those are muscles. That's not erectile tissue. They help maintain erection. All right, so the spongy urethrum is lined with a transitional ET. So look at that. You tell me, is that simple or stratified? Do you remember what that means? Simple, one layer of cells. Stratified, many layers of cells. So which is it? It's stratified. It's not in the name. The transitional name came about, histologists thought that this tissue was a transition between stratified cuboidal and stratified columnar. It's a transition. Well, anyway, we just call it transitional epithelium. It's a stratified tissue there. Okay. Any questions on the anatomy of the penis or erection or anything like that? So we're going to move on. Well, the male duct system, an overview of that can be memorized by the simple acronym SUP. Seminiferous tubule, epididymis, vas deferens, ejaculatory duct, N is nothing, urethra, penis. So that's just kind of like an overview of emission. That's what we're going to go through. Emission, ejaculation. Now emission should be in your notes already. It's movement of sperm up to the urethra. So we got to go through a lot of structures to get there, and there's some details left out of here. So let's go through the entire male duct system for emission and for ejaculation. Male duct system. It starts in the testes. In these tubes, if you remember, we had talked about the tunica albuginea, this whitish innermost layer that folds in these little septum that create these little compartments. And what I had said was that those little compartments will contain a few seminiferous tubules, and that's where the sperm are made. So that's where it starts. That's the term that you should already know. And you should already know, well, we're in the testes. Squeeze that in there. It's pretty obvious where we are. And this figure I found, not this one, this one. They just kind of get rid of everything except the duct. The duct where the sperm have to swim through. And the seminiferous tubules, as you can see, they all kind of converge right here. This is called the rete testes. That's where sperm will swim to next after they break off the tubule wall. So think of this as like the journey of sperm, everywhere they gotta go. Rete testes. It's a net. Well, shaped like a net. Now, after that, there are several efferent ductules that sperm will swim to get into the head of the epididymis. Efferent ductules. So what I'm doing is I'm just listing the structures that sperm are going to swim through. Okay. Efferent ductules will get you to the epididymis. P-I-D-Y-M-I-S. But I did teach that there's a head, a body, and a tail. Okay. And the proper way to name that is to always put the specific part and what it's of, tail of epididymis. If you just say tail, like a dog tail, I mean, if you don't describe your adjective, it's tail is just a descriptor for the epididymis. Always remember that, okay? There's a lot of things in anatomy you call a head. Now, after that, you make this U-turn and then it becomes the Ductus Deferens. What's next? Now the Ductus Deferens, that's kind of when you get out of the testes. So we're within the spermatochore now. A little side note, if you want to sterilize a male, that's kind of where you cut. Cut and ligate to make a man sterile, a deferectomy or vasectomy. It's easy to get to. It's outside the body cavity. It could be done in the urologist's office. Okay. Let's see. But this is reproduction, and that will be the opposite. so I don't want to spend a lot of time talking about that procedure. The ductus deferens, it has to go over the bladder and behind the bladder. Okay, it's going to go through the inguinal canal, it's in the spermatocord, over the bladder, behind the bladder. Now, when you look at the bladder, this is a posterior view. You see a lot of things, but the ductus deferens, that's the ureter. That's where urine is transported into the bladder. But this is the ductus deferens going over that. And this part here where it gets widened, that's called the ampulla of ductus deferens. Put that in here, the end of it. Now the ampulla of ductus deferens, ampulla just means it's the wide part, and it happens to be at the end. Okay. This is kind of at the end, right before you go into this structure here. That's the prostate gland. So let me move on. This figure actually shows you got sperm, you're delivering it to the ejaculatory duct that's inside there. However, sperm, they kind of need help along their journey at this point. So it's like you're going to have a lot of other secretions with the sperm, and they're all going to kind of mix in this location. This 1, 2, 3, those 3 glands will all have secretions that contribute to the semen to help sperm along its way. And I'll define all of those glands and secretions later. I just want to continue with the duct system. So this figure matches, I took a posterior picture of our model on the wall, against the wall, didn't have the chance to study it. But what I wanted to do is I wanted to cut this open, this picture here, to show you that inside of there, let me go back a couple of slides already. Okay, this right here. Here's a side view. And where this dumps into the prostate gland, it literally is right there, and that's called the ejaculatory duct, and that's the next thing you ought to know. It's in the prostate. Okay. What else can I say? This kind of marks the end of emission, because emission is movement up to the urethra. So we're there. The next thing is the urethra. And emission. Okay, and then you get, well, ejaculation is movement out of the urethra. So let's talk about the urethra. So I'm going to go back to where it was, this picture here. I mean, this up here is the urinary bladder. You can see that the urethra in the male, semen and urine both share the urethra. Of course, never at the same time. During ejaculation, there's a sphincter here that'll like contract to keep urine, any urine that may be in the bladder, keep it in the bladder. So ejaculation right here, there's little holes right there. Those are the orifices for the ejaculatory duct. So this first part of the urethra, which is inside the prostate, is called the prostatic urethra. So now we're talking about ejaculation, movement out of the urethra. So then for urethra, know the 3 parts. The prostatic urethra, membranous urethra. The membranous urethra, that's the part that pierces the UG diaphragm. And also, Following that is the spongy urethra contained within corpus spongiosum. Somebody pointed out to you prostatic, membranous, then the rest of it spongy. The orifice at the end is called external urethral orifice. All told, the urethra is about 8 inches in length, and it's much longer than in females, as we'll see. So the openings of the ejaculatory duct, the red arrow is pointing to it. Okay, that's how you get in there. Now I want to go back and teach, that's just the movement of sperm, but I want to show you again those accessory glands that contribute to the semen volume. Clear the board. Before I raise all of these structures, if you have questions about any of these structures that we listed, I call this the male duct system. It's the journey of sperm all the way from where they made it mature here, all the way out. Okay, you have to swim through a lot of things. Now, sperm can't make it by themselves. They need all this help and nutrition within the semen to help them reach their destination, which would be fertilization of the egg in the female reproductive tract, which I'll teach next. All right. So seminal fluids. Typical ejaculation may include 3 to 5 mLs, and there may be something like 20 to 100 million sperm per mil. But along with the cells, which is the most important content of the semen, unless you've been sterilized, are all these other seminal fluids contributed by the prostate, the seminal vesicle, and the bulbourethral gland. So I kind of color-coded it. That's the prostate right there, the red arrow. And the red font kind of describes its secretion. So the prostate gland, it's described as a fibromuscular gland. It actually can contract during ejaculation. Okay, so it's fibromuscular, can contract. Its secretion is slightly acidic because it contains citrate, like citric acid, like in OJ. Acidic secretion due to citrate. You need that for cell metabolism. All right, so after that you have the seminal vesicle. Now they're located next to the ampulla of the vas deferens, so don't confuse seminal vesicle with the ampulla of Ductus Deferens, because they kind of are close, and they're going to share that ejaculatory duct. Well, I should mention that the prostate gland, what does it secrete into? The prostatic urethra. Makes sense to me. Secretes into prostatic urethra. And then you have a seminal vesicle. they have the majority of the secretions, about 60%, as it says on the slide. It's an alkaline fluid. That means basic. And that'll help, will neutralize the acidic secretion of the prostate gland. It'll also help maybe neutralize any trace acid from urine that may be in the spongy urethra. Yeah, that's all I'll say. It's just the alkaline secretion, but it is about 60% of the seminal fluids. That little green one, it's shaped like a pea. It's called the bulbourethral gland. Both the seminal vesicle, let's see here, well, let me just say it. Both the prostate and the seminal vesicle, they both secrete directly into or indirectly into the prostatic urethra. It's like the sperm and all of these secretions, they're kind of coming together in the urethra. The bulbourethral gland, however, will secrete directly into the spongy urethra. Okay. It's a clear fluid. It's also an alkaline mucus, like the seminal vesicle. Now the name is useful. It'll help you locate it. Bulbourethral, the bulb of the penis. Usually I look for it close to the bulb of the penis or the UG diaphragm. That's kind of where you'll locate it in our models anatomically. So look for it. Bulb of penis or UG diaphragm. So in terms of semen, I already told you about how many sperm are in there. Just make a note to yourself. All these other things, I just kind of listed. I think they're important for you to know to help the journey of sperm after ejaculation. They have also, well, I mentioned citrate, but fructose can be metabolized by the cells, the sperm. There's prostaglandins that'll help. There's a mucus plug at the cervix. So here's the female anatomy. Ejaculation occurs, it will accumulate here. The ejaculate will be accumulated here. And it has to get into the cervix. And there's a little mucus plug there that you can dissolve. The goal is to fertilize here in the oviduct. That's where the ovulated egg should be if it's the right time of the month. So to get there, there's a reverse peristalsis that occurs, which is basically this uterus is like a washing machine. It'll contract and help wash the sperm backwards up into there. Okay. There's a relaxant to increase sperm motility. There's, I mentioned all the alkaline fluids. There's a seminal plasmin to destroy bacteria. And there's a fibrinolysis, so it frees the sperm from semen, which is sticky, to help fertilize the egg when it gets close. And so ovulation occurs at day 14 of the ovarian cycle. So if it's really close to that day, it should be waiting right around there. I have read that sperm can swim from here to here in about 5 minutes. So a cell can't swim that far by itself in 5 minutes. So all these other things I'm mentioning, like for example that, it really should accelerate the process. So fertilization can begin. Now once you're fertilized, you don't have implantation. There's a couple of things here. You have fertilization right here. For about a week, the fertilized egg will stay there and it'll undergo the first cell divisions of development. One cell becomes 2 cells, 4, 8, 16, and so forth, for about a week. In about a week, 10 days, it'll kind of make its journey here for implantation. And then, you know, once that happens, I'll talk about that later. But that's the journey of sperm. I want to kind of stop it there. So that's a nice transition for the female anatomy. I'm going to open those slides up. We'll start with our sagittal section. Okay, and I got a couple of pictures here. I have the pelvic hemisection there, sagittal, mid-sagittal, right through the pelvis, so you can see all the urogenital structures. And I put this picture in here too, so you can get a posterior view of the uterus, ovaries, and oviduct. So to give you an overview of how the female anatomy contributes to human reproduction. Let's see, I'm going to erase this board. I have the 3 E's as an overview to help students understand the female side of reproduction. They do most of the work, okay? They have to carry the baby to full term. And now for that to occur, the first thing that happens that has nothing to do with sex is simply the ovarian cycle. That's driven by hormones, not the female sex response. And so that occurs on day 14. The ovaries are located in the posterior abdominal wall. Well, anyways, here they are dissected out. And the ovary is colored pinkish, and it looks all pustuculated and scarred due to many ovulations. So a female that's sexually mature will have approximately, 1 ovulation per 28-day cycles on the 14th day. So the first E is that the, actually not the 3 E's, that's for males. 3 receives. Okay, the 3 receives. The first receive is that, what do I mean by that? The uterine tube must receive an ovulated oocyte. Call that number 1 of 3. Uterine tube, also called the oviduct, also called fallopian tube. Okay, most commonly books now are calling it uterine tube. It must receive oocyte. That's the egg. Okay, that term is still used. It's more of a lay term. The proper name for that cell that is to be fertilized by the sperm is oocyte. And that must be received during ovulation. Again, that's day 14 of a 28-day cycle. And I'll define that cycle probably, I forget when that lecture is going to be, maybe Wednesday of next week, I'm not sure. Now this day 14, if you're going to conceive, that's the day. okay? Maybe the next day, but in any given 28-day cycle, it depends who you talk to. I think you got 2 days. That's what I think. This day, or maybe the day after, because this cell has maybe a 1-day lifespan in the oviduct. So you got to make it, and there's no guarantee that you get sucked up in there. Okay, it could just fall into the peritoneum, and chances of fertilization there, you don't want that. Okay, you want it to fertilize right there. So the typical site of fertilization, well, we call it the ampulla of the uterine tube. Ampulla of uterine tube. So the anatomical structure is, boom, ampulla of uterine tube. So the uterine tube is this whole thing, but, well, the whole thing is, you know, just a tube right there. But the ampulla is just the end of it, the part that's a little bit wide and at the end, you know, just like the ampulla of Ductus Deferens. Well, if you're going to fertilize, you got to have sperm there. So the second receives is the vaginal fornix must receive ejaculate. So the vaginal fornix, a fornix is a recess. And this is at the junction between the vagina and uterus. So let me show you something here. In the pelvic cross section, you got uterus, there's like an angle here. Here's vagina, and then it kind of angles that way. So you kind of have this sideways V shape there. Anyways, the vagina, which means sheath, receives the penis during intercourse. Okay, but the key is the ejaculate, it must accumulate here. The fornix is this recess around the cervix, okay? So it goes like 360 degrees around the cervix. It looks like a sliver here, but during the female sex response, one other thing is the fornix, it kind of like expands, it becomes bigger. And the cervix kind of gets up and out of the way. So that creates room for like, it's called a seminal pool. So vaginal fornix must receive ejaculate, forms a seminal pool. Okay, that's the term that's used, a little pool of semen in that little area. So after sex is over, everything kind of shrinks back, and the cervix will dip down into that pool and suck up the sperm, and hopefully fertilization will be achieved. Okay. So again, fertilization doesn't mean you're pregnant. It just means you fertilized. The next journey is, the third receives is, the uterus must receive the fertilized oocyte for implantation. Now the fertilized egg, to be technical, and I like to be technical, this is a college class, it's called a blastocyst at that point in development. It will become baby. Okay, so the uterus must receive the fertilized blastocyst for implantation. About a week, about 7 to 10 days post-fertilization. So that's the third receives. That little ball of cells, it's got to be allowed entrance from uterine tube to uterus, which is this upside down pear-shaped structure. On the sagittal view, we can see there's a little cavity on the inside there. So it's a space that the fertilized egg, hopefully it sticks, and then it starts to implant. It'll literally eat its way into the endometrial wall, which is the inside lining of this uterus. So that's kind of the overview here. The key is to understand these 3 points. Fertilization, that's the key. But that's just the first major thing. The second thing is implantation. Both of those things are crucial for fertilization. Okay. Well, I guess I should also put ovulation too. I mean, there's a lot that have to happen, but it's hard to like boil this thing down into 3 words, but that's a pretty good job. Ovulation, fertilization, implantation. Okay, all of those things have to happen, otherwise you can't reproduce. All right, so if you do get pregnant, look, this is the normal flexion of the womb. It's right over the bladder. Okay, you're between the rectum and the bladder, and it's right over it. So if there's a big baby developing in there, and it pushes down on the bladder, and it may feel like you have to urinate frequently. You're just kind of crushing the bladder. All right, let's talk about the perineal region for females. So for here, the bicycle seat looks a lot wider, okay, as compared to the males. It's because females have a wider pelvis, which is good. It's an adaptation for childbearing. So the perineal region, it's the same for males and females in terms of what you call it. The UG triangle, the anal triangle. When you do the dissection, here, let's point out let me list on the board what the muscles I think you should see here. It's the same. There's the deep transverse perineal and the superficial transverse perineal. We saw it in the male too. I would list this under UG diaphragm. Yeah, I give you the page number in the atlas so you can look it up. So deep and superficial. Transverse perineal. Part of the UG diaphragm. I would also list those erector muscles that I listed for the male. The bulbospongiosus and the Ejaculatory. They're in the female too. Erector muscles. So for the female, same name, bulbospongiosus, as well as the Ejaculatory. Right, so let me point them out here. What I had mentioned about the bulbospongiosus before, it remained open in the females. So what they do is, there's the muscle right there, but on the other side, they cut it away so you can see what it covers. That structure is called the vestibular bulb. Bulbospongiosus covers vestibular bulb. So in males, what was the vestibular bulb? Bulb of penis. Okay. So this is erectile tissue, just like in the male. Okay. So this time it's covered with bulbospongiosis. All right. So I mean, what's the function of this? For the males, it is the penis. Well, this is erectile tissue. When this becomes engorged with blood during sex arousal, Now there's a gland right next to this bulb, and it's not pictured here. I wish they would show it. It's right, it would be right there, right below it, okay? So I'll point to it in other pictures, all right? So there's a gland next to the bulb. The gland is called greater vestibular gland, right next to the bulb. So I'll put it here. Look for greater, I'm running out of room here. Look for greater vestibular gland next to the bulb. So, because I want to teach you the function of the bulb. The function of the bulb is when it becomes filled with blood, it kind of fills up and it compresses the gland. The gland will secrete a lubricant during sex arousal, so it'll lubricate the area for intercourse. So it's important to know that the gland and bulb, I guess they kind of work together in that way. The other thing, it's part of the clitoris, the Ejaculatory, they cut it away right here. Ejaculatory, you see it cut away right there. That is, remember you had the crust of the penis, the little legs of the penis? This is like the legs of the clitoris. Okay, this is crust of clitoris, erectile tissue. It's covered by that. So the Ejaculatory covers crust of clitoris. On this picture, you can also see the glans clitoris. Also, there's also body. So there's crust, glans, body. On this picture, you can see the glans clitoris is right here. Okay, the body will be deep to it. Let's see here. I'm going to move on from this picture and show you just the external genitalia, just what the obstetrician would see during an examination. Okay, there's the clitoris. Specifically, that's the glans clitoris. They call that skin that covers it the prepuce, although I usually don't ask you to identify that. But the actual erectile tissue, the clitoris, is right there. That's the only part you can see. Now, this area here, it's bounded by the Labia Majora, which is a plural term because they're paired. Let me write that down first. Labia Majora, that's plural because you got two, one on each side. The singular term is labium majus. Should you ever come across it? I usually just call it labia majora. Well, anyways, it's the part, it's basically skin with hair follicles, okay? The function is basically cushion and protection. The top part here is called the mons pubis, where you have pubic hair. And that's why they call it the pubic bone of the pelvis. It's where you have pubic hair. And then, interiorly, you have the labia minora. Again, that's the plural word, or you can just call it, for one, labium minus Although plural, singular, if you're identifying it, I really don't care. Okay, just don't mix them up. Well, anyways, there's no hair. This kind of protects, they have it reflected back. The function is kind of to protect these orifices. I'll just put protection as a function. The area that's contained within the labia, if you were to reflect them back, is called the vestibule. The vestibule is, they point, you have to point to somewhere. I don't like where they point. The vestibule is kind of the space in front of the vaginal orifice and the external urethral orifice. So, the vestibule consider it the space contained between labia minora. That's how I would describe it. Other books may say something slightly different. Anyways, this space, what you're going to see within it, vaginal orifice, external urethral orifice. Look for vaginal orifice. An orifice is it's an entryway into something. Vaginal orifice, external urethral orifice. You have other pictures here. This is a model that's been labeled for you. Sometimes they call this region the vulva. I don't really use that term, but it's a term that is used by other anatomists. And I kind of just labeled all the things. Someone else labeled it. I added some things. Let me see if I can turn the lights off. They do have the deep transverse perineal muscle shown there. They show the issue cavernosa, this muscle here, and on the side there, the bulbal spongiosus. They do show, let's see here, the greater vestibular gland. Oh, okay. Well, let's move away from this. This model we don't have in the room. Let's look at this one. Okay, this one we have in the room. That's my hand. I took this picture. Okay, this one is the deep transverse perineal, the superficial transverse perineal. These two heads are both of issue cavernosus. And you can see the bulbal spongiosus right there. I think that's a good picture. And they have two numbers there. Okay, these are the labia. So which one's this? Majora or minora? Yeah, it's the outer one, yeah, the majora one. I updated your study list yesterday. I decided you don't have to know this. So make a note to yourself. You're not responsible for levator ani. I used to teach it because it supports the pelvic viscera. Supports the repro organs, but it just used to give you a headache. And I couldn't figure out why, because you're already supposed to know it from 4:30, but don't worry about it. So moving on. Don't gotta know it. So like for example in this picture, the muscles of the levator ani are the 17 ABC, but I erased them, so don't worry about it. But do worry about these structures down there. There's the glans clitoris right there. I just call it clitoris, but if you want to be specific, it goes glans, then body. You can't see the crust. Okay. There's our labia, minora majora. That's the urethra. That's the vagina. Okay, so appreciate that both the vagina and the urethra in the female must pierce the UG diaphragm, the muscle of it being the deep transverse perineal. So this right there is the deep transverse perineal muscle. And that's the rectum anus. We're not concerned with that in this unit. Okay. So those are some of the things I mentioned. Okay, I'm going to move on to ovaries. The ovaries, I showed this picture here. It's a superior view. Let me orient you. You have urinary bladder. We're not concerned with that. That's the rectum. We're not concerned with that. That's the uterus. That's what we're talking about here. There's the ovaries there. Okay. The little pinkish structures. You can see how the oviduct or uterus is right there. I wanted to talk about the coverings of the uterus, as well as the ovaries, as well as the uterine tube. So if you look at this picture here, it's like if you drape all of it with peritoneum. Okay, and when you do that, if you were to cut away this section here and kind of look at it from the side, that's how they generate this picture. And it's useful because it shows students the relationship of the uterine tube to the ovary down there. And it shows how this peritoneum, it kind of just wraps around everything. And this is basically called the broad ligament. It's a big supportive ligament, but it's more like a big sheet that covers everything. And when it covers the uterine tube, when it pinches right below there, it's called the mesosalpinx. So it's a double membrane. So think of the broad ligament as having three parts. First part, mesosalpinx. Now the mesosalpinx, it's right below the uterine tube. That's kind of where it's located. And salpinx means trumpet, because I guess they think that the uterine tube looks like a trumpet. The pinching right above the ovary. Okay, here's the peritoneum covering the ovary, but where it pinches above it, it's called the mesovarium. Superior to ovary. That's what I'm writing. Then the largest part of the broad ligament is called the mesometrium. Now they show it there. Basically, it's pretty much all of this on the lateral aspect of the uterus. So mesometrium, I'll say it provides lateral support to uterus. So you are responsible for the three parts of the broad ligament. And, well, that's a model in the room I found. Well, that's probably the best one that shows all three parts. Okay. What you're looking at is the uterus, the vagina, the uterine tube, as well as the ovary. There's a structure up here. I don't know what that is. Don't worry about it. But anyways, mesosalpinx, mesovarium. You can kind of see where there's a change in the angle there. It's kind of where that'll help you identify what's what. And then on the side of the uterus, that's mesometrium. So the other thing about the uterus is, if you study the uterus in the front and the back, there's these little pouches on the back and on the front. And these don't exist in the male because men don't have a uterus. So if you follow the red line, that's the peritoneum. Okay, and just kind of covers everything as it lines. All right. So all the stuff highlighted in green is underneath or behind the peritoneum. Well, anyways, the little pouch that's between the bladder, the urinary bladder, and the uterus is called the vesico-uterine pouch. And the little space behind the uterus, but in front of the rectum, is the recto-uterine pouch. And you're responsible for those. So also study the recto-uterine pouch. The vesico-uterine pouch. Vesicle refers to the bladder. It's a vesicle, it holds urine. If you look at the uterus, if you remove it, and then if you were to take it out and then make through the frontal plane, you get this picture. So you have the vagina down there, you can see the uterine cavity, you can see the thickness of the uterine wall there. So there's a lot of anatomy that we have here. Let's see here. Okay. So the uterus has regions. Let me write that down. Uterus. So the regions include fundus of uterus, the body of uterus, and there's a line called the isthmus, as well as the cervix of uterus. So let me point to these three regions here now. The fundus, that's the part you can palpate over the pubic bone, but it's just the top round part. Most of it from here to here is the body. Body always means that anatomy, it's the bulk of the organ. So it kind of goes all the way down, but do you see how as you go down it kind of narrows? That constricture right here, where they call it the internal os, that's where the isthmus is. At the level of internal os. Os is opening. That's how the sperm gets in. Well, anyways, any point below that constricture, from there to there, that's all cervix. The cervix is basically the inferior 1/3 of the uterus. It's called the neck of the uterus. Cervix means neck. Part that narrows. For the cervix, it's important to note the canal that goes through it. You have a cervical canal within the cervix. And you have an internal os and an external os that bounds the canal. So it goes os, but then canal in between. So I would note all three of those. So within the cervix, note the, I guess if you want to think about in terms of the sperm getting in, it's got to go through the external os first, correct?
When you say it's highly acidic too?
Yeah, yeah, it is. In the vaginal canal, there's a lot of, it's an acidic environment. All right, so just note those structures. It's important to note the cervical canal. The cervix must dilate. Okay, during, if you're going to fertilize, you have to let sperm in. But I'm thinking in terms of labor and delivery, the cervical canal is the birth canal, along with the vagina. It must dilate. During labor and delivery. Okay, about 10 centimeters. It's the birth canal. Cervical canal is. So, I'm sorry. It's internal os, external os, not canal. Made a mistake there. I want to get through enough so you could know what to study during the lab. And I'm going to shift gears for lab. Before you take a break, when we come back from break, we're going to have time to study models. But I wanted to show you a few things. Give me a second to pull them up.